Really interesting, the relationship between medical knowledge and power. It really reminds me, I've done a little bit of work on insane asylums, and there's this disease from the sort of early to mid 19th century, religious mania that sort of gets revived after emancipation. And so sort of it comes up, initially 1830s, 1840s as a response to Irish people migrating to the Northeast, essentially. And so they must be religious maniacs, essentially because their religious practices were different, right? And so this is a sort of a way for, WASP, like white Anglo-Saxon Protestant people, to exert power over these new groups, right? Who are poor and migrant and different. And they must be bringing disease, right? And then, it's retooled after emancipation, where I study in Louisiana, by former enslaver scientists, essentially to sort of say, well, African Americans have different religious rituals, right? Growing out of slavery and, the slave trade and all of that, right? It's a unique experience. They have different religious traditions, and therefore they must be religious maniacs, and this must show, therefore, their racial or mental inferiority. And I guess, when we take a step back and we start to think about the way that thinking gets crystallized, I think we can see just how dangerous that is and how it might lead to, let's say, disparities in care even today. I think one of the striking things, like my family is from New Orleans, and the doctors think my mom might have had COVID, but she can't get a test. So they don't know, it's just maybe, but I mean, I think part of that is, the geography, right? Because New Orleans is a fairly Black city, right? And it does kind of, I think you have to wonder, why is it that some places get tests? Why is it that some places get equipment and others don't? I don't know. What do you think?
I think what you're hitting at here is not only just the particularity of this administration, but also the sort of problem when healthcare is for profit, right? And so as soon as people can make a profit, then that's where the exploitation begins, right? The fact that it's unlikely that they, like poor, Black residents of New Orleans or Chicago or Detroit, are going to generate profit for the people in power. They move lower on the list of priorities, right? And that's sort of the underlying sort of eugenic thinking, even when it's not explicitly, well, in some ways it is explicit, but even when the actors are not naming this as a eugenic practice, the sort of ways in which particular lives, places, groups of people are valued is one of these sort of afterlives of eugenics, right? The fact that some people are treated as though they have more value than others, or that some lives are more worthy than other lives, is an inherently sort of eugenic idea. But, eugenics plus capitalism equals basically what we're seeing right now.
Wow.
It's a bad combo.
It is.
It really is.
The worst combo.
Yeah. And so I guess one of the questions that I had then is the Trump administration's response tends to get panned as a failure, and if you could put that in a hashtag, it would be epic fail, coronavirus edition or whatever, right? But I kind of wonder if they view it that way. I don't mean Trump himself. I mean, I think Trump sees himself as sort of God's gift to humankind, right? I mean, I don't know how someone could manage to give a daily press briefing for I don't know how many hours for how many days every day. But I do wonder, are there ways in which we can see negative ways in which we could see their response perhaps as succeeding or as achieving certain ideological ends?
Maybe in the sense that, if we go back to the sort of the premise of the American experiment, right? The system wasn't designed to protect particular people, right? The sort of founding origins of this country are not designed on protecting Black people. They're not designed on protecting people with disabilities. They're not designed to protect the marginalized. That was never the point, right? Even if we want to sort of think about the sort of founding principles as having some noble underpinning, right? There's still, this was not part of the intent, right? And we're still seeing the afterlife of that. That historically in this country, the state has not been designed to protect Black people. And this is just the latest episode in that long, heinous, ongoing series, right? The system was never designed to protect people with disabilities. It should be, but it's not. And that's why racial disparities and the sort of vulnerabilities that we're seeing now are playing out in this way, is because the system is serving the people that it was supposed to serve, and it's not serving the people that it was never designed to help in the first place, right? And what we, I think, with the benefit of being historians and doing research and having hindsight, and also, you know, thinking critically about these issues, is we have the opportunity now, in this sort of strange moment of fracture, to think about what would the system look like if it was designed to protect the vulnerable. What could we imagine a world in which, right, there's something that there's a better way to do this.
Well, and that's what I keep coming back to this question. When thinking about the Trump administration, I keep thinking, I go back and forth, like, is it intentional? Like, is there actually a plan, or is it so haphazard as to be kind of, or I don't know, maybe more troubling? But what I'm left with, because it's hard to know, and we're probably not going to find out in the next few weeks whether or not, we're not going to find the smoking gun. But what I'm left with is precisely what you're saying, which is that that everything that we're seeing is like, there's nothing new about what we're seeing. It's just an amplification of already existing conditions, right? And so I guess there's part of me that I don't know, like, wants to sort of, or is hesitant about laying this entirely at the feet of the Trump administration, not because I support what they're doing at all or support them, but because I think it risks obscuring the sort of the depth of the problem, and the fact of its already existence, right? I mean, it has been there. I think a lot about insurance companies, for better or worse, and the system of rationing that they put in place along the lines of, who is insurable and who is not, and who will get access and who will not. Like, the rationing has already been happening. It just doesn't happen within the sphere of healthcare provision, because once you get in, right, I mean, that's where it happens. It's sort of at the point of access. And so I guess I don't know what to necessarily make of that, but it's also, I also don't know where this fits into the conversation that we're having in this very moment, but I can't stop thinking about the distribution maps that have been going around, and the fact that ironically, it seems to be that the hardest hit are in fact largely supporters of this administration. Right? I mean, isn't that what we have, that it sort of follows, that there is some correlation between red state status and death, right? Or morbidity and mortality rates, I guess. So I suppose that is sort of connecting back to our conversation about leveraging, like, what is being leveraged if some of the people who vote for you are in fact dying off. Does that make sense?
That's such a good point. I was thinking about that also because if you look across, like, the South, right, the rates are growing, right, and there's a number of southern states that are really digging their heels in about stay-at-home orders and social distancing orders, right? But these are states that largely, with exceptions obviously, but largely support the administration, largely are, governed by the Republican Party. But it's almost like there's a disconnect between the ways in which people understand their relationship to the administration, their relationship to power, versus like their actual lived experience, right? And I don't know quite what to make of that disconnect, but it's becoming painfully obvious that that's exactly what's happened, right? The demographics that are, some of the demographics that are most affected by this are in fact supporters of the administration. But on the flip side, there's also the other variable that within these red states, the people that are having the highest mortality rates are in fact Black people that are less likely to be supporters of the administration. And so there's this weird, again, another sort of disconnect in the response of the administration. You would, and that's what I think when you were getting to the point of how much of this is intentional and how much of it is haphazard, right? Like I think there's some of it, there is some intentionality because of the sort of structures that exist in the ways that, you know, funding is cut and pandemic responses are, you know, stifled. But I think there's also a haphazardness because it's because of the particular issues with this administration. It's a weird, it's a combination of both at the same time, and it's playing out in these really odd and also devastating ways.
I mean, it's shape shifting, right? And I hate to do this, but I often think about Hannah Arendt's Origins of Totalitarianism, and thinking about like the shadow government back here, right? And the sort of, so you have the forward or the external facing rhetoric, and you have the sort of systematic, on the one hand, the systematic recreation of the government into the sort of shadow, right, where all the power actually rests, and then you have the sort of hollowing out of all of these already existing government institutions that continue to remain in place, but are really just, it's nominal, right? And I think about the ways in which the State Department, for example, or the sort of, you know, the pandemic response, like all of these sort of safeguards that were in place have been sort of systematically dismantled. Maybe or maybe, I don't know if it had anything to do with hoping that a pandemic would occur and kill off, you know, certain populations, but the decision to destroy those institutions certainly was intentional, right? I mean, that's been clear since day one, that imploding the state was a goal.
Right.